Hi, it's Teresa Zimney. I have with me here today again Laura Keller, who's the Director of Public Health Nursing here in Napa County Health and Human Services. Thank you for joining me again. So today I want to talk about the evolving practice of public health nursing and how the research on brain development has informed the practice. Could you talk about the latest research on brain development, and then what does this tell us about caregiving and the future of success for our children?
Well, there's really been a huge explosion of research on brain development in early childhood, and it goes back now about 25 years. And when it first came out, it was so groundbreaking and mind-boggling. Just to think that this first primary relationship was so impactful, and that what happens in the first year or the first 3 years of life makes the footprint for everything that's going to happen to that child later. So when the first research first came out, I remember when Bruce Perry's research came out, and he had gone to Romania and studied all the infants who were warehoused in orphanages. And they did PET scans of their brains, and they actually saw that the children, because of lack of nurturing, their brains were actually smaller, and there were parts of their brains that didn't develop, and they called those black holes in the brain. And you can see it on the PET scan. It's really alarming. And it wasn't that the people in those orphanages didn't want to care for the babies and the children. It's just that there weren't enough staff, and so the children didn't get the nurturing, consistent kind of loving care that they needed. And plus there was a lot of change of caregivers. So a child would start to get attached to one person, and then there's a shift change, right? And somebody else comes. And that's really disruptive to babies and children and their brains. So the idea that the consistent, nurturing, loving care lays down the wiring of the brain, and Bruce Perry really built a beautiful model for that, and that it also wires the stress response forevermore for the child in terms of sort of an over or under-reactive stress response system. And the other component of that that's so important to our work is the whole idea of mutual and self-regulation, that the baby learns to self-regulate first through mutual regulation with the caregiver, the mother, or the parent. And that's a basic building block for development. If that system doesn't work correctly, then the subsequent building blocks aren't in the right place, and the brain's not wired in the way that it should be. So that's what we found out early on, when we really realized it's the relationship that matters, because babies learn in the context of this meaningful relationship, and if they learn how to regulate, then they're calm and open and present, and we call that in baby language the quiet alert state. But that's the state where you get to fall in love and you learn things, and that's when you're ready and available for relationships. So that pivotal piece about relationship is the fundamental building block for children, but for humanity, really, for everything that happens, all the learning later. And there's so much push right now on early learning, right, and school readiness, but we can't start when children are 3. Right. If we start at 3, that's great, but we should be starting prenatally and right after the baby's born, to give parents the support and the education, the support they need to support and fall in love with their babies. So that was all the initial research, and more recently there's so much more research now on epigenetics and ACEs, adverse childhood experience and trauma, so that now we know when children and babies are exposed to toxic stress or toxins in the environment or poor nutrition, that it can change gene expression, the epigene, like turning on or off a gene expression, so that something happens early in childhood shows up later as a chronic disease condition, or obesity or hypertension or heart disease, or mental health, emotional issues later in life.
So after even this child is born and formed, their genetics can be altered by these experiences.
Right. And so the work of Folletti and Onda, who did the ACEs study, showed that the more adverse childhood experiences you have, as your ACE score went up because of trauma, the higher incidence you had of these later problems in life. So it made us understand a lot of what we couldn't articulate before about intergenerational or, you know, these chronic problems that happen with people. And now we understand, and it doesn't mean that has to happen to you. There's resiliency built in, but it does tell us that we really need to provide the support and early care so that mothers and babies and families are supported. Because it changes your genetics, basically.
Right.
It changes your life trajectory.
And the families that you work with are some of the most high-risk families that we have, where these conditions or these environmental situations are leading to, or could potentially, if it weren't for the intervention of public health nursing.
Right.
Wow.
So it's the thing about having, you know, if you're expecting families to be able to fall in love and nurture their children, they have to be surrounded or have significant, meaningful relationships with other people, like a home visitor or people that they interact with in the community or at their health center or their provider office, because it's the relationship that is sort of the catalyst for change and healing. It's not just all the stuff we do with families and the brochures we give them or the papers. It's the relationship piece that is the catalyst.
So as this research informs practice, you know, there's a lot of talk about evidence-based practices, and in community health or public health nursing, I mean, talk a little bit about how that works.
Well, things have changed over time, and one of the things I love about Barry Brazelton's work is he was doing this and talking about this way before it became evidence-based practice. And now we have many other models that utilize those kinds of theories and what you would call more of a systems approach. You know, there's Strengthening Families and Healthy Family America and Nurse-Family Partnership. And those are evidence-based practice. The thing that's a little bit of a downside about that is it tends to sometimes make services siloed, because the criteria for fitting into an evidence-based practice is sometimes very narrow, and then you have to follow the guidelines of that evidence-based practice to keep fidelity to the model. So an example is Nurse-Family Partnership, which is a wonderful program with great results, is only for first-time mothers. So in field public health nursing for maternal-child health, there's many, many families that need support, that it's not just their first baby. And so then if you do nurse-family partnership, you can only see that population. So to me, it speaks to the need for more of a systems-wide approach and a way to join different evidence-based practices together and align the approach. So, and also use multidisciplinary teams, like some home visitors are nurses, public health nurses, some might be early Head Start home visitors, some might be Healthy Families America, paraprofessional home visits. But if you align that system together, so each part has their niche, but they have an underlying conceptual framework and a way they're doing service that everyone shares, that's a much stronger approach and has a much, I think, more profound impact on families and on the community as a whole.
So the public health nursing, it's a community-based health service, and with this very, very interesting research on brain development, I definitely see, I can connect the dots, the impact. You're out in the community, you have this expertise, working with families, at-risk families, making these connections, loving relationships, helping brains develop, and I can see the future of our children.
Yeah.
That's wonderful.
Yeah, that's how I see it too.
Yeah. Thank you.
You're
again.
welcome.